When a person stands with his eyes closed and his legs joined, he or she starts swaying forward. What happens to the muscles when they stretch? The muscles which stretch, they stretch, and what they do? They contract. The person falls backwards. The muscles in the back stretch and then contract. So, our standing position is the result of instantaneous contraction of lots of muscles. The muscle tone impacts their irritability, the muscle's irritability. The lower the muscle tone, the more it needs to stretch for further contraction. If the muscle tone is good, it stretches slightly and then it contracts. This is how these pictures are created. You see how unstable this person's position is. The person seems to be falling down. His front muscles can't control him, but another person falls down less. Thus, when a person's position is optimal and static, you can basically perform the muscular testing. Statics is the muscular testing of the whole body. Muscles get strained, then they stretch, and then they contract. But we are interested not in all muscles, but in some of them, because each muscle has its own reflexive connections with a certain meridian, with a certain organ, with a certain vertebra. It has its own innervations. There are connections with emotion, blood, and lymph circulation. That's why it's so important to know how to test in the same way as the body tests itself, being in half vertical position. I believe it is clear. Thank you very much. How do we perform this testing? It includes 3 stages. At each stage, muscles contract differently. What is contraction? Please come here. The muscle is in its normal position. The arm goes up. The fixing points get closer. This is called concentric contraction. The muscle goes down. The fixing points stretch. This is called eccentric, stretching contraction. The muscle contracts but gets static. This is isometric contraction. This is the contraction when a meter turns to iso without the length change. The tone increases only. For the muscular testing, we use all 3 levels and all 3 types of muscular contraction. The first variant, we contract the muscle. Let's say I want to check the deltoid muscle. I contract the muscle so that it's only this muscle that works. The arm doesn't go up or down, the shoulder doesn't go up, the body doesn't bend. It's just one muscle that contracts, and it's concentric contraction. After I perform the concentric contraction, I start the second stage. I'm asking the patient to perform isometric contraction. I ask her to press upon my arm with her arm. I'm waiting for 3 seconds, and I'm asking again. If her contraction force increases, the second stage of contraction is fulfilled. Now we need to see what happens when we stretch. Please press against me. Once again. You see, I'm stretching now, and the contraction is still there. It's the same as here. The patient is standing. It's isometric contraction. The patient is falling down, the muscle is stretching and contracting. Muscular testing leads to the same result as one's vertical position. What is good about muscular testing is that there is nothing false in it. Everything is created by nature. We just look at what nature does and we repeat it. To perform each stage of contraction correctly, we need to work on all these stages, and we'll do it right now. Stage 1. It seems to be the easiest. It seems to be so easy to lift your arm for the muscle to contract. But it's not as easy as that. It's not as easy as that. The first challenge is that all muscles move in three directions. Let us take the greater pectoral muscle. It has flexure, adduction, and it also has inner rotation. One muscle performs all three motions, but I can't perform three motions at the same time, so originally I have to perform two motions. What are they? First I perform flexure, then I perform inner rotation, and I have one motion left, which I'll be checking, as I have already performed the other two. That's why it's so important to position the patient's body correctly, so that you will have the two motions. The muscle performs contracted, and only then I am asking the patient to press against me and perform the motion. Stage 2. When you ask someone to resist, he tries to do his best. What does he try to do? He's turning, he's trying to lift his pectoral arch, he's trying to bend his elbow. Why does he do that? Because he feels that the muscle we test is not good enough for testing. So the patient tries to compensate this with his other muscle. So we miss the patient's neurological disorder. That's why some patients move their body forward or turn it a little. Thus, it's so important to position the patient correctly, first of all. What is the correct position? If I want to test the shoulder joint, I'd be okay with the sitting position. But it's not okay to test the legs. But if I want to test the legs, I'd suggest the patient to lie down. Please lie down. Yes, like that. If I test the lumbar vertebral muscle, I lay the patient and then I check. The lumbar muscle performs three motions as well. It lifts the leg, turns the leg, and adducts the leg. For this motion to be correct, I have to perform two of them together. First, I'm bending the leg. I'm turning it. And only after that, I can lift the leg. It's very important for me to see that the motion is directed upwards, not inside and not forward, but strictly upward. That's the challenge. Thus, don't start manual muscular testing if you don't understand where the muscle is attached and what three motions it performs. That's why we have to perform two motions before we start moving, and then we test only the third motion. That's why it's crucial to position the patient's body correctly, and the goal is to direct his muscle along the medium line. Please sit down. Here is the deltoid muscle. It starts at the shoulder joint and it rounds it. It rounds it like that. To test it correctly, we need to position the arm so that the whole myofiber is positioned along the same line. This helps us to perform the motion exactly with this muscle. Rule 1. You must position the patient's body as good as possible. Rule 2. You must stand correctly. You must stand correctly. If I test the deltoid muscle, I stand at the back. But if I test the subscapular muscle, I'll stand next to the patient. But I can also stand in the front. Your own position should be as good for you as possible so that you could stabilize the attachment point with your own hand and test with another. It's very important to position your arm at the angle of 90 degrees. It's because all muscles cross the joints. If I position my arm at a different angle, I fix the joint. And I lose the subtle reaction of the nervous system to the isometric load. That's why you must ensure the angle of 90 degrees between your arm and your patient's arm.